Short stature is one of the commonest reasons for referral to a paediatric endocrinologist. Most children grow fastest in the first 2 years of life, so they grow between 30 and 35 centimetres. After that, then growth is relatively steady throughout childhood, so they grow at 4 to 7 centimetres per year until puberty, at which stage then they have a growth spurt in line with puberty. And girls usually have their puberty growth spurt early at the start of puberty, whereas boys have their growth spurt later on. Some babies who are born big at birth may cross centiles in the first 2 years of life in line with their genetic potential. When assessing a child for possible short stature, accurate height measurement is essential. And it's important that this is done by a fully trained nurse who has been trained in measuring height. We use a wall-mounted stadiometer to measure children in our paediatric clinics. It's also very important to know the parent's height in order to assess a child properly with short stature. Some children are small because they're from a small family, and therefore knowing the parent's height is very helpful. The most common cause of short stature are familial short stature, but other conditions such as constitutional delay of growth and puberty, in other words, the child is a late developer, may mean that the child is short now but will have a growth spurt later on. Although most children referred to the paediatric clinic with short stature are normal or normal for their family, if the child is not grown at a normal rate or has fallen off their centiles, they may need to be investigated further. The causes of short stature are broad and include genetic conditions, problems with the thyroid gland, celiac disease and deficiency in growth hormone, among other conditions.